Good day everyone! Have you ever wondered kung paano yung sobrang liit na bagay na hindi natin nakikita ay may malaking epekto sa milyong-milyong tao? Viruses are microscopic at kaya lang sila dumadami ay kapag nasa loob na sila ng isang living body. Dahil mabilis silang kumalat, isa sila sa pinaka-importanteng concerns natin. Today, we will share with you 3 key components or 3 key points. First, paano kumakalat ang mga viruses? Next, mga karaniwang sakit na dulot nito. And finally, paano tumutulong ang healthcare workers para maiwasan ito. Simulan na natin. So una, through the air or ang tinatawag nating airborne transmission. Kapag ang may sakit ay umuubo, bumabahing o nagsasalita, naglalabas sila ng maliliit na particles na lumulutang sa hangin. Halimbawa, nasa loob ka ng classroom o jeep kasama ang taong may flu. Tapos, bigla siyang bumahing ng walang takip. Kapag nalanghap mo yung hangin, maaari kang mahawa na sa kanya. Ang halimbawa nito ay flu, COVID-19, and chickenpox. Fresh ventilation at ang pagsusuot ng mask, ang dalawang may malaking tulong para maiwasan ito. Pangalawa, through direct contact, sa pamamagitan ng pisikal na hawak tulad ng pakikipagkamay, pagyakap o paghawak sa may sakit ay nakakapasok ang virus sa mata, ilong, bibig o sugat. Halimbawa, nakipagkamay ka sa kaibigan mong may sipon na tubo, tapos hindi ka nagugas ng kamay, at hinawakan mo ang iyong mukha. Doon na pupasok ang virus. So ang measles at herpes ay kumakalat sa ganitong klaseng paraan. Tamang paghuhugas ng kamay at pag-iwas sa malapitang kontak ay simple pero effective. Pangatlo, gamit at lugar na nahawaan. Pwedeng mabuhay ang viruses sa doorknob, cellphone o mesa ng ilang oras hanggang ilang araw. Halimbawa, hinawakan mo ang hawakan ng pinto o ininom mo ang baso na ginamit ng taong may sakit, tapos hinawakan mo ang iyong ilong at bibig. Doon ka na mahahawa. Common cold at COVID-19 ay kumakalat sa ganitong klaseng paraan, kaya mahalaga ang regular na paglilinis. Pang-apat, through body fluids, mga virus tulad ng hepatitis B at HIV ay naipapasa sa pamamagitan ng dugo o ibang body fluids. Halimbawa, kung gamit niyo pareho ang karayom o kapag nadikit ang dugo ng pasyente sa sugat mo, pwede kang mahawa, kaya dapat laging tayo sumunod sa safety measures. At huli, through insect bites. Ang lamok ay nagdadala ng virus na nagdudulot ng dengue at zika. Halimbawa, may lamok na nakakagat sa kapitbahay mo na may dengue, tapos nakagat din sa'yo yung lamok na yan. Maaari ka na rin mahawa sa kanya. Ang paglilinis ng paligid ay nakakatulong para mabawasan ang mga ito. Ang pagkakaalam kung paano sila kumakalat at kung paano ito nangyayari sa araw-araw natin, ang susi para maprotektahan ang ating sarili at ang ating komunidad. This also help us understand kung paano ito pinamamahalaan ng ating healthcare teams.
When we look at all these infections together, it becomes very clear that viruses do not follow a single pattern. They can spread through the air, contaminated food or water, bodily fluids, animals or insects, and also through close human contacts. Because of these different modes of transmission, viral disease remain one of the most important challenges in public health. Some infections cause short-term illness, while others can lead to lifelong complications, disability, or even death. Understanding how these diseases spread and affect the body helps explain why prevention and control are so important. Let's look at some viral infections that continues to shape the public health today.
Measles is one of the most contagious diseases known to humans. It spreads through the air when an infected person coughs or sneezes, and the virus can remain in the air or on the surface even after the person has left the area. This makes it extremely easy to transmit, especially in crowded places. Measles often begins with a fever, cough, and rash, but it can become very serious. In unvaccinated children, it may lead to complications such as pneumonia, severe dehydration, ear infections, or brain inflammation, which can cause permanent damage or death. Even though an effective vaccine exists, outbreaks still occur in communities where vaccination coverage is low. Poliomyelitis, commonly known as polio, is another viral disease that once caused widespread fear across the world. It primarily affects children and can attack the nervous system, sometimes leading to irreversible paralysis. During major outbreaks in the past, many families live in fear of sudden disability. The introduction of polio vaccines have been one of the greatest achievements in medical history, reducing global cases by more than 99%. However, polio has not been fully eradicated and continues to exist in a few regions, requiring continuous vaccinations, efforts, and monitoring. In tropical and subtropical regions, Zika virus disease is mainly spread by Aedes mosquitoes. Most infected individuals experience mild symptoms such as fever, rash, and joint pain, and some may not show symptoms at all. However, Zika gained global attention because of its severe impact on pregnancy. If a pregnant woman becomes infected, a virus can affect fetal brain development and lead to birth defects such as microcephaly. This highlighted how even a seemingly mild viral infection can have serious consequences for future generations. Chickenpox is another well-known viral infection that commonly affects children. It is characterized by itchy, fluid-filled blisters that spread across the body. While it is usually mild, especially in children, it can sometimes cause complications in adults or individuals with weak immune system. One important fact about chickenpox is that the virus does not completely leave the body after recovery. Instead, it remains inactive in nerve cells and can reactivate later in life as shingles, which cause painful skin rashes and nerve pain. Other viral diseases have also had a major impact on global health. COVID-19, caused by a novel coronavirus, spread rapidly across the world and led to a global pandemic. It affected healthcare systems, economies, education, and daily life, showing how quickly a new virus can disrupt modern society. Hepatitis B is another serious infection that attacks the liver and can become chronic, increasing the risk of liver cirrhosis and liver cancer. It spreads through blood and bodily fluids and can be prevented through vaccinations.
HIV, Human Immunodeficiency Virus, a long-term viral infection that weakens the immune system by attacking important immune system cells. If left untreated, it can progress to AIDS-acquired immunodeficiency syndromes, making the body vulnerable to many infections. Although there is no complete cure, modern treatments allow people with HIV to live long and healthy lives when managed properly. Dengue fever. Dengue fever is a mosquito-borne viral disease common in tropical countries. It spread through Aedes mosquitoes and can cause high fever, severe body pain, and bleeding in severe cases, known as dengue, hemorrhagic fever. In some situations, it can become life-threatening, especially without proper medical care. Rabies. Rabies is another viral infection that is almost always fatal once symptoms appear. It is transmitted through the bite or saliva of infected animals, commonly dogs. The viral attacks the nervous system and eventually affects the brain. However, rabies is preventable if treatment is given immediately after exposure, highlighting the importance of quick medical response. In conclusion, viral infection continue to shape public health because they spread in many different ways and affect the body in complex and sometimes severe ways, while medical treatments and advance have significantly reduced the impact of many diseases. Prevention remains the most powerful tool. Vaccination, proper hygiene and vector control, safe practices, and public awareness all play a crucial role in reducing infection. Cure can help disease, but prevention is always better than cure.
So, good day everyone. I am Chrissy Jane Santos and I'll be discussing to you our concept of our topic. So, let me start with a quick scenario. Imagine this. Pumunta ka sa hospital because you just have a fever and cough. Akala mo simpleng trangkaso lang. But what if it's actually a viral infection that can spread to others? Now there's the question. Who is the first person that can stop the virus from spreading? Not the doctor, not the medicine. Come on, think guys. Yeah, you're right. It's the nurses. Nurses and healthcare workers are often the first line of defense. When you arrive, sila yung unang mag-a-assess, checking your symptoms, asking you questions, and deciding if you need to be isolated. For example, during outbreaks like COVID-19, many nurses were the first to identify suspected cases. Because of their quick actions, they were able to prevent the virus from spreading outside or inside the hospitals. Second, they play a big role in infection control. Why? Simple things like proper hand hygiene, wearing PPE, isolating patients who has infected of the virus, and this might look basic to others, but this is the most important thing when preventing the virus from spreading to others. Imagine a nurse who forgets to sanitize their hands after handling a patient who has a virus or infected with the virus. That one mistake can spread the virus to the another patients that the nurses handled. But because they are trained and careful, they help to break the chain of infection.
Third, nurses are also educators. They teach patients and families how to protect themselves. For example, if someone has dengue, nurses will educate the family to remove stagnant water around their home to prevent mosquito breeding. So, hindi lang sila nag-aalaga. They also teach people how to prevent themselves from getting sick again. Another important role is monitoring patients. They continuously check vital signs and watch for worsening symptoms. Let's say a patient with influenza suddenly develops difficulty of breathing. A nurse can immediately notice this and act as fast as possible. And lastly, they are advocates of public health. During outbreaks, they promote vaccination, report cases, and educate communities. They don't just care for one person, they protect the entire community. So, when we think about it, nurses and healthcare workers are not just part of healthcare, but rather they are the heart of it. And without them, controlling viral infections would be much harder. And one of the most important lessons we can learn from them is that even simple actions like washing our hands, staying informed, and protecting others can make a big difference. So next time you think about who fights viruses, remember, it starts with the people on the front lines. Thank you.